Welcome to reflect this topic about mental health promotion and mental well-being of migrant families. My name is Katja Raitio and I will introduce this topic. I will give some examples about mental well-being and encourage you to assess your own ideas about this topic. There are some questions during the presentation that I would like you to consider. Please take your time to think about them. You can also print a working sheet and see the questions from there. Okay, let's start. What do you think about this topic? I think this is an important topic. Why we want to highlight the importance of migrant families' mental well-being. Here you can see the answer as World Health Organization defines it. There is no health without mental health. Now I will explain more about it. Concerning children, it is clear that the phase of early childhood is important in shaping their cognitive, emotional and physical development. Parental mental health disorder is a significant risk factor for children's mental health problems, developmental deficiencies and somatic symptoms. Compared to the inhabitant population, immigrants and refugees in particular have a greater risk of developing mental health disorders that also could affect the second and third generation immigrants. In addition, traumatic events and need of treatment is essential to keep in mind. In many cultures, mental health issues and especially problems are considered shameful and are feared. There are loads of stigmatization and taboos around this topic. The youngest refugee children require special attention, but they and their families remain often neglected, not least because example professionals currently lack the transcultural knowledge required to access them and address their specific needs. All this highlights the importance of openness and promoting mental well-being of migrant families as a part of social services and healthcare sector. Let's continue. What mental health includes, in your opinion? All the answers were correct. Mental health includes our emotional, psychological and social well-being. It affects how we think, feel and act. It also helps us to determine how we handle stress, relate to others and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood to old age. World Health Organization defines mental health as a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Nowadays, we have many other concepts related to positive mental health. We can talk about mental well-being, positive psychology, self-efficacy, psychological flexibility, resilience, recovery, participation, and so on. Okay, over the course of your life, if you experience mental health problems, your thinking, mood and behavior could be affected. What do you think? What factors contribute to mental health problems? As you could see, many factors are thought to contribute to the onset mental health problems. It is important to remember that mental health problems are not self-caused. Therefore, that was the wrong answer. Nowadays, one of the most common explanations of mental health disorders is stress vulnerability model. We all have the potential to develop mental health problems, no matter how old we are, whether we are male or female, rich or poor, or which ethnic group we belong. Those who do not have high levels of vulnerability are less likely to develop psychological problems when high stress levels are present. When stress levels increase, those individuals who are more vulnerable might be more likely to experience problems. In this slide, you can see that immigrant families and refugees might have some special risks and stressors which can cause loads of vulnerability for them. The risk factors might be related to time before departure, travel and transit, arrival, or integration. There might be only one risk factor or many of them. It is good to remember that we all have stressors in our lives. Are you able to recognize what kind of stressors you have in your life? So, why to promote mental health? Isn't this obvious? More we promote mental well-being, less we have mental health disorders. According to the World Health Organization, the burden of mental health disorders continues to grow with significant impacts on health and major social, human rights and economic consequences in all countries of the world. Common mental health disorders are responsible for the largest proportion of the global burden of disease. Yet, there is sound evidence that these disorders, as well as severe mental health disorders, can be successfully treated using evidence-based interventions. It is said that about 25% of people are affected by a mental health disorder at some point in their lives. However, at the same time, more than 70% of persons who need mental health services lack access to care. Here are some viewpoints of the challenges. As you can see, depression is the leading cause of disability worldwide. There is a huge increase with the prevalence of depression, almost 20% in the past 15 years. Excessive use of alcohol is known to predispose people to mental health problems. Alcohol consumption is a causal factor in more than 200 disease and injury conditions. More than 5% of all deaths worldwide are alcohol-related. Interestingly, alcohol abuse is connected quite often to post-traumatic disorder, which is quite common with refugees. There is a recent study which reports that domestic abuse victims are more likely to suffer mental health disorders. The rates of physical and/or sexual violence by an intimate partner range a lot between the countries. This is something what needs to be taken into consideration. Over 800,000 people commit suicide each year. It is second most common cause of death among 15 to 29-year-old, and 75% of all suicides occur in low and middle income countries. It is essential to remember that all these viewpoints might affect to each others, and quite often mental health problems are combinations of many issues. What about when we talk about migrant families? Prevalence of mental health disorders in refugees and migrants shows a very high variation across different studies. According to these studies, depression is ranging from 5% to 44% in refugee and migrant, compared with the prevalence of 8 to 12% in the general population. With anxiety disorders, prevalence ranged from 4% to 40% compared with reported prevalence of 5% in the general population. The only disorder for which substantial and consistent differences in comparative prevalence have been reported is post-traumatic stress disorder. This is specific for refugee groups, ranging from 9 to 36% in refugees compared with 1 to 2% in host populations. Interestingly, refugees who have lived in a host country for more than 5 years tend to show higher rates of depressive and anxiety disorders than the host population. Estimates for prevalence for depressive disorders and anxiety disorders are typically 20% or more in long-term refugees. So, what do you think about this? What does this tell us about the need of mental health promotion of migrant families? Is there something we should take into account? Do the families get all the support they need from this point of view? One interesting point for this discussion is that how mental health and physical health are related. Does mental health affect the physical health? What did you answer? If you remember from the beginning, there is no health without mental health. According to studies, poor mental health is a risk factor for chronic physical conditions. On the other hand, people with chronic or difficult physical conditions are at risk of developing poor mental health. When compared to the general population, average life expectancy is 16 to 25 years shorter for people with severe mental health disorders. So, mental health really affects to our physical health. One interesting mind and body connection is somatization. Somatization describes expressing psychological distress through physical symptoms that cannot be attributed to medical illnesses. According to studies, immigrants, especially from less industrialized countries, are often assumed to express distress more through somatization, and people from Western countries through psychological symptoms. Such differences could seriously complicate healthcare for immigrants that usually focus on either physical or psychological health. Moreover, medically unexplained somatic symptoms are often resistant to medical treatment, and somatizing clients' attitude towards psychosocial treatment can result in unfavorable outcomes. We have now talked about challenges, risks, and consequences. Next, I would like to highlight the role of protective factors and things that support our mental well-being. It is important to support the coping and good things in our everyday life. Can you recognize what kind of protective factors you have? I hope that you found many of those factors. We can do small, everyday things to promote mental well-being. Here are a few tips how to do it in practice with migrant families. Do things with others. Spending time with family or friends, meeting new people, and getting involved in activities can make a difference to how you feel. Encourage migrant families to get involved in community activities, in voluntary work, family clubs, etc. Do something creative. Activities or hobbies can keep you distracted, have a positive impact on your sense of mental health and well-being, and can help to increase your confidence and self-esteem. So encourage migrant families playing games or instruments, gardening, art, doing a puzzle, painting, cooking, baking, drawing, writing, etc. There are loads of possibilities to be creative and many things which are free. Invest time in relationships. Connecting with people and investing in good relationships are important for your mental health. Encourage migrant families to get in touch with people who they trust or feel good around. Ask them to give them a call, send them a message, or organize a meeting with them. Focus on strengths. Having positive thoughts can help you feel better. Take time out. When you relax, you give yourself permission to let go of worries for a while. Relaxing gives your mind and body time to recover from the stresses of everyday life. You can ask migrant families to try some relaxation e-tools and applications to guide how to relax. On the other hand, maybe you could guide some practices. Sleep well. We cannot function properly without sleep. Sleep helps us to repair and restore our bodies and minds. If someone is not able to sleep and suffers, example on insomnia, help him or her to get professional help. Keep active. Your physical health plays a key role in keeping you mentally healthy. Encourage family members to go out for a walk, take them for a bicycle trip, or something else what they would like to do. What about you? What you could do to promote your own mental well-being?